What up, ZPac? It's your boy ZDogMD. Check it out. I'm live and direct out of the Portland Hilton in Portland, Oregon. I'm so excited to be here. Getting here was a bit more difficult, but now that I'm here, I'm excited because I'm speaking at the Kitsaber Symposium tonight for the Foundation for Medical Excellence, and I posted about this a while back, so hopefully Oregonians that are members of the ZPac are going to show up and represent Health 3.0, you know what I'm saying? But anyways, the topic for today's show is calling in sick to work, and let me tell you the circuitous way that I ended up at this topic. And I want to start also with a little housekeeping. Shop.zdogmd.com is up and running. We ran out of I Narcan Your Honor student female shirts, but we're going to get them back up hopefully soon. So we brought back the limited edition Zezus shirt. So definitely check that out. These are great gifts for a Z-Packer or people you want to, show that you're super edgy and dope in healthcare for Christmas. And the thing is, we take the revenue from those shirts and put it into a fund for specifically earmarked for producing dope videos for y'all. So any money you spend there, not only do you get a dope shirt, but you get to actually, or give a present, you get to actually support the production of future videos, including videos for physical therapists, occupational therapists, social worker, case manager coming soon, as well as RT. I know y'all been asking for it. And EMS, we haven't forgot about you either. All right, so that being said, let me make sure that we have sound and that y'all are hearing me, because sometimes that goes wrong. And then I'm going to tell you the story of how I got to Portland and why we're talking about sickness. Hey, we got it. There's your comments. Okay. I flew Southwest, which, as y'all know, I love Southwest, but it is a cattle car. So I'm jammed up against the window, right? And in come in these, like, to sit in the middle and the aisle, huge people, like it was a couple, and they are big, and I'm, little Z, crammed up in the corner, and the woman sitting in the center was so big that just the spread of her arms, it was like there was an elbow in my face, all right? On top of that, everybody on the damn plane is coughing and sneezing, and a dude behind me sounded like he was going to puke. And my first elephant conditioned response was, what are these? What's wrong with these people? Why are they traveling when they're so sick? Are they out to harm other people? Like, this is a crime against everybody else on the plane. And then I took a breath and realized, wait a minute. We do it in healthcare all the time. We go to work sick as a dog on the regular. Sometimes it's part of our culture of suck it up. Sometimes we have no choice because our employer or our group will not allow us to take sick days without penalty. And sometimes we just don't know how sick we are and we show up like idiots. Even though we're in healthcare, it's, physician and nurse and PT and dietitian, heal yourself. So it started getting me thinking, this is what we should talk about today. So I put out a poll on Facebook. Let me get this thing up here because you guys like polls. I said, do you go to work sick as a dog from time to time, or do you call in sick? And it was pretty clear what the answer was. We had 16,600 votes so far in 5 hours, less than 5 hours. And 70% of people basically said, I go in hell or high water. Doesn't matter if I'm sick. And 31% call in sick. Now, this doesn't surprise me because of my own experience in the hospital. And it doesn't surprise me because there was a study or some data recently that says the vast majority of healthcare providers have reported going in when they're sick, even when they have a fever. All right. Now, in my entire 10-year career as a hospital doc practicing at Stanford with my group, I never once called in sick. Once I called in because my wife was having a baby, and my good friend, Dr. John Kniff, valiantly covered for me and took my shift even though he was off. And so I still am grateful for that. But I never called in sick. Now, does that mean I wasn't sick? No. It means I had horrible upper respiratory stuff. Sometimes I had GI stuff, and I would just suck it up and go in. And I would wash my hands fastidiously and wear a mask. But was that really keeping my patients safe? Was it in the best interest of the general health of the hospital and my patients and of my own health and the health of my family? Because the sicker I am, the more likely I am to get them more sick if I don't have a chance to get better. But that was the culture of it, because in my situation, if I called in sick, someone who was off, like literally wasn't working, a doctor who either had days off or was on vacation or something else would get called in because no one else is there to see the patients. So it was just simply a question of, who do I hurt? And then when I come back, I'm going to be disoriented. All the patients' stuff's going to have happened to them. So there's all that stuff that goes through your head. So I asked y'all in the survey, give me comments. Let me have your voice, and then I will bring, because part of the purpose of this whole incident report platform is to give you guys a voice. So I said, let's do that. And you guys had some great comments. And I pulled some of the comments that caught my attention, and I want to go through them. Now, the other thing I want to say before we get into that, while I was on the plane, I learned a way to cope with severe plane-related anxiety. Everyone's coughing. I'm jammed into a corner. It's claustrophobic. Remember, I did a incident report about meditation in this book I was reading, The Mind Illuminated, which, by the way, if you go to amazon.com/shop, amazon.com/shop/ZDogMD, that's not complicated. It's got a list of all my recommended books and gear and stuff. So this book's called The Mind Illuminated. We were talking about this and how it has sort of jump-started my meditation practice. Well, I was on the plane. So the first thing I did was I took these. Where are they? Let me grab them, because you guys got to see these. I took these, and I'm in Portland right now for people who are just joining. We're talking about sick days in medicine. I took these noise-canceling Tautronic headphones, and they look something like this. They cost $45. I'll put the link on after. Actually, you know what? Here, I think I have it copied already because I was sending it to someone. I'm going to put the link in the description right now. You can buy it through Amazon, and also, if you do buy it through Amazon through this link, you send like a couple pennies our way, which is nice. Again, we'll put it in our video production pile. So I put this in. Let me just get this for you guys right now, because I love these things. And again, they don't pay me. This is just me saying I love these things. Here they are. Okay, they're in the comments now. They're noise canceling. So you put them in, they fit right in your ear. So already, even without turning them on, it's pretty quiet around me. Like I can barely hear myself talk. And then you turn this little switch, and boom, all the rumbling and low frequency noise is gone. And so I put these in my ear. And the nice thing about these, I love them for travel because, or if you're like on break in the hospital, just put them in, like you don't want to be bothered. Put your pager on vibrate or whatever, your phone on vibrate. And they're so tiny that when you're done, you can just pop them in your pocket. So I put these on, and again, I love them. And everything got kind of quiet. I could just hear mumbling, a little coughing, a little sneezing, and then I did my meditation practice. And I thought it would be too distracting, but part of the practice of meditation is actually identifying distractions and then refocusing back on the breath. So I was able to do that. The next thing I know, an hour and a half had passed and we were on the descent to land. So highly recommend getting into meditation because it can help an airplane flight turn from an ordeal into a chance to better understand and train your mind to be less reactive and all the other things we talked about. All right, now, that being said, let's talk about your questions and comments on coming into work sick. Let me pull them up, the ones that I pulled. So Kayla Dever, from the poll that I posted, wrote, I'm a stem cell transplant nurse. My patients routinely have a white blood cell count of less than 0.1. If that was my loved one and a snotty nurse came in to take care of them, I would tell them to get the F out. So I call in at least when I know I'm contagious. It's just the right thing to do. All right, so here's an example of the ethics, the morality of coming into work sick. You're around immunocompromised patients. Whether you wear a mask or not, you still have a chance of contributing illness to a population that can die from getting infected. It's the same reason you should get a damn flu shot, all right? But that's another talk that we've done. So that being said, should you stay home? Well, the answer is if you're having fever, if you feel like you're contagious, if you're going to make people sick, then yes. And if you're getting over something, you probably should wear a mask. So this is all true, but the question is, what happens when your employer, first of all, doesn't have policies, and there were plenty of comments on this, or you don't have coverage? What do you do? This is the conundrum we find ourselves in healthcare time and time again, because while we're asked to support our patients and be very altruistic, almost like in no other profession, we're asked also to go above and beyond with regards to our personal health and the safety of others by coming in when we're always understaffed. Well, if you don't come in, you hurt someone else on your team, or the patients don't get seen. So let's read some comments about that. So Rosemary Wright says, depends. I feel awful or guilty either way, whether I come in or stay home. I hate this part of medicine that doesn't value our health or mental health. That's what it is. In the 10 years I was at Stanford, I never called in sick because it was like, it felt to me, correctly or incorrectly, like stabbing one of my colleagues in the side and twisting a knife, when I should just take a couple of pills of suck it up, wear a mask, and go. Well, I'm also taking care of 90-year-olds who are immunocompromised. I'm taking care of young people on steroids who are immunocompromised. I'm taking care of cancer patients. And, with those patients, I would glove, I would put on the mask, I would wash. But still, like, what if there's something on your shirt or your coat? It's just not the best thing to do. But what choices do we have? And that's what we want to talk about. So another comment. In my hospital system, says Lizette Van Maastricht Gordon, you are allowed to call in sick only twice a year. Twice! Otherwise, you will be in discipline. You also earn, keyword earn, PTO, paid time off, which has to be used for sick days, and cannot be taken during holidays such as Christmas and Thanksgiving. Not sure how that's even legal. Well, I don't know the legality of it, but I know that these are policies probably that sprung up via administration to keep down costs, make sure people are staffed, and also, frankly, to stomp out some degree of abuse, which will always occur in systems like this, where it's on Scout's honor. Are you sick or not? Right? You don't need a doctor's note. You don't need anything like that. And, of course, any of us can get a doctor's note pretty easy. Hell, I'll just ask any of my homies. I've never had to do it, but it wouldn't be hard. So this is why these systems exist. The question is, are they productive? Are they going to encourage you to do the right thing if you're sick? And the answer is probably not, right? Let's read another comment here. Andrew Wilson says, I work as a paramedic. The issue with us and many in healthcare, we are not special, is that if there is not two of us in the unit, it's inoperable. Unfortunately, due to severe staffing shortages, there is nobody to take your place, and that puts the public at a greater risk. We bitch and moan, but at the end of the day, we put our patients and the public first. It's a cultural thing in healthcare. If we don't show up, nobody will. Intellectually, we understand the risk of getting others sick. So Andrew Wilson nailed it. This is the heart and soul of it. We go into this thing to help people. We feel responsible for others. We feel responsible to our team. We feel responsible to our employer. We feel responsible to ourselves to step up and work. And if we're sick, we will take 2 suck-it-ups and call no one in the morning, because that's how we are. Is that the right answer, or should we have some processes in place to actually staff up and cover up and all of that? One thing to remember, and we did a talk on this, for example, just for doctors in this country, we have in the developed world one of the lowest ratios of doctors to patients in the world. So in the developed world, in other words, there are very few doctors to a whole lot of patients in the U.S. And there's many reasons for this, which we talked about in our previous show, is Scrooge McDuck destroying America. But the bottom line is we are understaffed. We're understaffed with nurses. We're understaffed with us. We're understaffed with EMS. It's a big, big deal, our frontline emergency responders. So what do we do when we're sick? Now, I'll tell you, at least we have a place where we can bitch and moan about it, but what about real actionable change? Well, one of the things we can do is have more staff, be more effective with the staff that we have, but then have processes in place where there's an activation protocol when people get sick. But then we have to sort of shift a culture there where people cannot take advantage of a sick policy just to take off. Now, many people have kids that get sick. Many people have family emergencies. Many people are taking care of elderly loved ones. It is hard all around. This is true not just in healthcare, but in healthcare we feel it acutely because of those who depend on us in our jobs, not just our patients, but our fellow healthcare workers, our teammates, right? Let's read another comment here. So Cam Boosfield says, I suppose that depends. Considering 1 day a week that I work has no patients on site, it would be okay that day. But the downside is the other 4 days a week with patients and the doctor and I are the only staff employed there. So this is I think a front staff worker, front office worker. I don't know, Z-Dog, would you run a clinic without your receptionist? Just you running the whole show without support staff, right? So Cam would suck it up and go in. Otherwise, my boss and I both lose a day of work and the patients would have to be rebooked. It's too much work. So this gets to the other point. Many of us in healthcare, whether we're private practice people, we run our own office, we're on RVU-based payments. In other words, our payment is based on our productivity. If we take a day out for sickness, we don't get paid. So we're costing money. The patients don't get seen because who's going to see them, right? So you have to catch up. And as it is, we're seeing 30 patients a day. So now you've got this backlog such that even Cam, who's working the front there as the front office, is like, I ain't taking a sick day because it'll be a disaster. Dude, come on. Like, what are we doing? So again, even just shining a light on it is a start because we don't talk about this stuff publicly. Half the people on the board are scared to say anything because they're worried their employer will retaliate, right? Let's read another comment. Carrie Maddox, relating right to this. The challenge is that there are no sick leave. There's no sick leave, only PTO, which is lumped into one big category to be used for sick and or vacation. And that's the other thing. So are you going to sacrifice vacation days when you're sick? So many people in their own self-interest will say, hell no, I want to go to Hawaii with my family, or I want to like spend time in the mountains with my family. I don't want to take a sick day. So I will suck it up and come in to the detriment of everybody around me, right? It's the nature of it's the infrastructure that leads to the culture, and they feed each other, right? And here's the last comment. So this is horrible, says Janine Solis. This is from a patient now, so we're getting the patient voice. Why are there not sick days? I'm a patient that has practically no immune system due to my 11 kidney infections and 14 rounds of antibiotics. I had to stay home and not leave the house in hopes of not being exposed to a bad virus before surgery. I cannot afford to get sick or I'll be in the hospital on a vent or the ICU. Exactly right. So here's a good example. Like my parents-in-law, the grandfather is still alive at 103 and was staying with them in Las Vegas over the holiday, Thanksgiving. Some extended family visited, brought their kid who was openly sick and coughing everywhere. 103-year-old grandpa got deathly ill and nearly died. Well, that was preventable, right? If we changed the culture of how we think about, going out with sickness, if we can avoid it, especially if we know they're vulnerable people. This also gets into the whole vaccine, by the way. Vaccinate yourself so you don't injure others with your choices. All right. That being said, let's go and see if there's any new comments here. The system is obviously broken, says Doug Greer. There's nothing noble about working sick. Agree, the system is definitely dysfunctional, but we can start to make changes. Joey Lusty says, this is why no one wants to be a nurse anymore. I was once a new nurse 10 years ago, but this industry will pull you in and spit you out in the end. Well, that's an encouraging. Well, look, guys, so in a system where we're staffed up, where we have a culture of supporting each other, not letting each other down when we're sick, meaning we're able to call in sick because we know our team will step up to cover us, and we know that we will do the same if they're sick because we trust that when they're ill, and that we will do our best to support each other along with the golden rule, do unto others. So they will then return the support because that's what we do for each other on a team. That in the end is the heart of the Health 3.0 call to action on this. We have to do better. We have to work with our administrators. We have to work with people who are paying the bills, but we have to work with each other on a team too to say, hey, there's really no room for abuse of sick days, but there's also no room to come in when you're deathly ill. We got to make it a cultural thing. We almost need to bring an element of shame back. Like, if you come in really sick, you're going to get shamed, but only if the system allows you to call a sick day without being totally punished and disciplined. So it's a mix of things. It's kind of like hand washing is starting to become a shame issue. If you come out of a room and you don't wash your hands, you're going to get shamed by infectious control if they're there, and probably other people eventually. I think this idea of accountability to our tribe is actually very important, and it's a way we can kind of help make these things happen. So all that being said, I'm going to wrap up by saying the ZDogg shop helps us make videos. Go there, shop.zdoggmd.com. I'll put the link in the description. These cool headphones right, are high. I came to the conclusion today that they are invaluable noise canceling headphones, whether you're in a break room, you're trying to get away from it all, or you're traveling. So I'll put a link for these. And again, if you ever buy it through Amazon, a little bit of it supports the videos that we make. I want you guys to stay safe. If you're sick, call in, hit share, hit like. If you're really nice, if you help support us on Patreon, patreon.com/ZDogMD, we really, really appreciate it. You may wonder why I've been focusing so much on money. It's because doing this stuff costs a lot of money, and the plans we have for 2018 involve making a lot of content for you guys. So in order to support that, this isn't even profit we're talking about, this is just paying the costs of doing what we do. We need your help, we need your support. Things like this where we take your voice and actually put it out there to the world, to millions of people, ultimately in terms of reach, it's important. And I think without having these kind of platforms, we're the worse off for it if we're trying to build a better healthcare system for ourselves and for our patients. Anyways, that's my pitch, guys. I love you, ZPac. Oh, quick little tour of the hotel. We can't get by. I'm at the Portland Hilton. I'm giving a talk tonight for the Kitzhaber Symposium for the Foundation for Medical Excellence. Former Governor John Kitzhaber is throwing this thing and asked me to come and speak. And he's done a lot of work in the Oregon Health Plan and the innovation space in Oregon, and whether you agree or disagree with what he's done, he's tried very hard. He's a physician, an emergency doc who went into politics years ago, and so he's an example of someone who might be a physician leader in the space. And so I want to get to know him and see what's up, and also meet a bunch of Oregonian fans and make it happen in a 3.0 way. Here's the bathroom. You can see there's not a whole lot to say, and here is a little eating space where I ate a crab pot pie for lunch, and that's going to be my only meal of the day because I can't really eat right before I perform, and I'm going to perform tonight. All right, guys, I love you. Say hi to all your kids for me because Z-Dog loves them kids, not in a creepy way, and we out. Peace.